Good evening again, and welcome to another episode of Que-stead-Que. What you gonna do? I don't know, but something's gonna grow. Well, hello, you guys, and welcome to another episode of Que-stead-Que. This is my second episode of the day because I did not want this day to get by me without the promotion of ostomy awareness. Today is National Ostomy Awareness Day. And so each year I go to whatever platform I'm on and I speak about my ostomy. You may have heard me speak about it before, but today I kind of want to go into just a wee bit detail. And I'm going to try to keep this video short as promised earlier in the first video that I did today. Anyway, just to share a little bit of my story, back in 2010, as you all know, I had shared my autoimmune disease story when I first started this channel. So you can go back and watch that 2-hour video, okay? Because it's a long one, because it's been a long journey. But we won't even rehash that. We'll just pick up with the Crohn's and colitis diagnosis. Actually, in 2010, I believe, out of the blue, well, my mother and I had just moved in together. We had decided to become roommates, and we she moved out of her house, rented her house out, which was paid for, and then I was living in a house at the time, renting a house, and we decided to pool our resources, and we got this beautiful apartment on the lake. And so we had just moved in and everything, so I had been lifting and unpacking and things like that. And so one morning I woke up and I noticed that I had bleeding. And it wasn't a lot. It was just a little bit, from the rectal area. And so I told my mother about it, just kind of, nonchalantly. And I said, it's probably because I've been doing all this lifting, because a year prior to that, I had had surgery for hemorrhoids. And I thought maybe they had come back, or they were getting ready to come back, and maybe that was a sign of that. And so my mother said, well, if it continues, go back to the doctor or whatever. So I said, okay, I will. So maybe a week later, I noticed that it was still happening, although it wasn't much. And so this particular day, something else happened to where it kind of alerted me. And I told my mother, I was like, you know what? I said, I made a doctor's appointment, but that's not for another couple of weeks here. And so my mother said, and I told her what was going on. She was like, maybe you should go to the ER just to be on the safe side. It could be something, serious or whatever. So I did that. And my mother actually went with me. Don't you know, I ended up admitted to the hospital. And I was like, what? And so as it turns out, they wanted to do a colonoscopy and everything. They said it wasn't hemorrhoids or anything, but they did detect the bleeding, and it was much more actually internally than what was externally. So that's the reason why they admitted me. So I was in there for a few days. They did the very first colonoscopy that I ever had and all that. And so that led to my diagnosis. It revealed that I had colitis at the time, ulcerative colitis. And so the Crohn's came later, like maybe 7-8 years later. So anyway, I thought, wow, what is this? So I learned all about it. And I can honestly say that for the first, just about 10 years, if not longer, I didn't really have any problems with it. I just knew I had it. I took the medication. It was called Asacol, A-S-A-C-O-L. No, A-S-A-C-O-L, Asacol. And I was fine. I never had any issues with it. Well, fast forward to 2018. I was caregiving for my mother, and she had a ramp because she had to be transported to and from dialysis every other day. And so I had to set the ramp on the stairs that led up into the house. And so I was getting ready to set up the ramp, and I dropped it, and it landed on my right leg. Well, it broke the skin just a little bit, not much, and it hurt. And then it broke the skin a little bit. I put some Bactrim on it and everything, and I went on with my day and everything. I was fine. That healed up like in a couple of days. Never had any more thoughts of it. That was in the month of July. Well, later, on Christmas Day of 2018, when I ended up at the hospital because I woke up that morning out of the blue. My leg was swollen, and that area where I had dropped the ramp was red and inflamed. It was swollen. It looked like it had just been bruised. It was blue and black, had streaks running all the way up my leg. And so my sister, we were having Christmas dinner at my house, and my sister walked in, and I was like, look at my leg, Sherry. I was like, this is the leg I dropped the ramp on a couple of months ago. She was like, if you don't get your butt to the hospital. So that's where I spent Christmas of 2018. And so they were going to admit me, but he made me promise to take the antibiotics that he was going to prescribe. After they did an x-ray and an ultrasound on my leg, it turned out I had an infection. And so the doctor told me for all those months, from July up until December, the infection was brewing. He said, when you drop that ramp on you, he said, that's the ramp everybody's been walking up and down. You've probably never washed it, which you don't. Who would think to wash a ramp? He said that you got the kiss of death. He said every piece of bacteria known to man was on that ramp. And with you dropping it on your leg and breaking your skin, that's how you got the infection. He's like, but it took that long for it to build up and cause the problems that it has today. And he truly wanted to admit me because he was saying that it had taken off so bad that it could have, caused all kind of other problems, which could have led to like an amputation or death. I mean, I had no idea it was that serious. Well, I knew it was when I saw, that, but I had no idea at the time that it happened. And I told him, I said, I knew that it was unsterile and it broke the skin. And I told him I used Bactrim. He was like, that ain't nothing. He's like, you should have been going on an antibiotic the day that happened. But, I just didn't know. So anyway, he sent me home with this medication called clindamycin, which is an antibiotic. He gave me a prescription, and then they had given me a dose through the IV before I was allowed to go home to eat Christmas dinner, okay, at 11 at night. Anyway, what I did not know, and obviously this ER doctor did not know, no Crohn's or colitis patient should ever, that's the one antibiotic that no Crohn's or colitis patient should ever be prescribed or should they take, because it will cause inflammation of the intestines and can cause C. diff, a disease called C. diff. And most of you have probably heard of it. Well, guess what? 2 weeks later, I woke up and I was feeling horrible. And at the time, my mother was in the hospital. And I was like, while she's in the hospital and I'm feeling like this, let me go to ER and see what's happening with me. And maybe they can, figure out what's happening. I was in the hospital for a month from that day on. In fact, my sister, she had to come to my house because when Mom got discharged, she was there to be the caregiver while I was hospitalized for a month. I had the worst case of C. diff known to man. And so the infectious disease doctor came in and I learned about C. diff because I had I had heard of it, but I didn't, know what it was like and everything. It was terrible. And it caused my disease to just progress from that day on. And so when the infectious disease doctor came in and he started telling me about his daughter who had an ostomy. He was like, she had Crohn's so bad, she ended up with an ostomy at the age of 18 and blah, blah, blah. I was like, an ostomy? I was like, you know what? I said, my brother had one when he, was battling cancer and everything. I said, and I learned about it and everything. I said, but I don't think I'm to the point where I need an ostomy or anything like that. I was like, once we get the C. diff cleared, I should be fine. He said, your days of being fine are over. He said, once you have it, he said, with Crohn's and colitis, he said, you'll get rid of the C. diff. He said, but your Crohn's and colitis will be flared probably from this day until you decide to get an ostomy if your doctor suggests that's what you need or if it becomes an emergency situation. He's telling me this and I'm like, I'm telling people, well, they're saying I'm going to eventually need an ostomy. I was like, but I don't think so, blah, 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 blah. And I didn't think much about it, and I knew enough about ostomies because of my brother and I was I was forbade to even tell my brother's story because I was told that it's his story and he's no longer here to tell it. And I was told that he didn't like having the ostomy and he hated it and was ashamed of it and all this. I was like, I don't know if he hated it or not. I said, but I know he wasn't ashamed of it. And the reason how I knew he wasn't ashamed of it, first of all, he showed it to me. I asked him all kind of questions about it, and I'm glad I did because it made me go out and decide to learn about it to help him as much as I could while he had it. You know, his was he kept his about a year and then he had it reversed and everything. And I think that was a poor mistake, but, you know, that's neither here nor there now. He's gone. But anyway, the person who told me that, I said, that's not true. I said, because first of all, he told me everything about it and everything. And I said, he talked about how it saved his life. And then a friend of mine who I know did not know he had an ostomy and would not have known because none of us told it, approached me one day and she was like, oh yeah, I saw Roger and blah, blah, blah. He was telling me about his ostomy saving his life and blah, blah, blah. That's how I know that he talked about it and wasn't ashamed of it and everything because this friend would not have known about it unless he told her. No one else had told her. And so she had no reason to lie. So I said, no, that's not true. I said, but, you know, I won't talk about it. I said, maybe it's you guys who are, you know, feeling a certain way about it. I said, especially with me having one and then, you know, with him having one, I don't know. So I said, that's you guys' thing. I said, but I'm going to talk about mine. I said, you will not stop me from doing that. But then I thought about it later. I was like, no, if the time is appropriate to speak of my brothers, I will, because it did save his life. It bought him some time, number one. And secondly, it helped to save my life because going into it, when it did become an emergency situation and we were able to delay that emergency for a month, but I knew everything. I needed to know the basics, but I needed to learn how to care for it and everything. And I went in with an excellent attitude about it, and I have done extremely well with it. So with that, I thank my brother, and I share on behalf of him, you know, his memory, and on behalf of myself and my other ostomates. The other reason why I share is because I lost a friend to Crohn's disease who would have benefited greatly from an ostomy. And I believe that stigma may have kept her from getting the surgery because she lost her life to Crohn's disease. And I think it was horrible because she could be living now. She was still fairly young and everything. And I have helped others who have needed an ostomy and were on the fence about the surgery. They came to me and said, well, what's it like? And blah, blah, blah. I've helped others who have been, you know, just had it done. It's like people who needed the surgery just started coming my way after I got mine. People I knew at that, or people I knew who had a relative or a good friend or whatever. And they would always come to me and I would, you know, share supplies with them, tell them they could call me anytime, day or night, you know, if they had questions, these types of things. So I became an ostomy advocate. And so, like I said, now I promote awareness because everybody knows somebody with one. You all know me, but you may know someone that you love or someone that you see every day or you worked with or whatever. And they may have an ostomy. Everybody doesn't share it. Some people consider it very personal. And then there's a lot of stigma associated with ostomies. And so we advocates, those of us who advocate, our main purpose and goal is to, number one, promote awareness, let people know that an ostomy is a lifesaver. You don't just get an ostomy willy-nilly. It's a life and death thing anytime you need it, be it an emergency or be it because you need it because of a disease or whatever. But the bottom line is, if you need an ostomy, it is to save your life. Otherwise, you will succumb at some point. You know, it may not be right then and there, but it may happen, you know, soon. If a doctor gets to talk an ostomy, it's time to move, okay? All righty. And then also, I'm at first, and I see I'm into 14 minutes already, but I'll try to keep this brief. The first thing I want to say is I want to share the reasons why people get ostomies. It's not just because of IBS, IBD, or Crohn's or anything like that. A person can be in a car accident. If you get punctured, if you get injured, and let's say it nicks your colon or something's punctured on the inside, the doctor may need to do a temporary ostomy. You have temporary and you have permanent. Mine is permanent, it's for life. But temporary is for those whose colon need a rest or needs to heal, or there may be something else that may need healing on the inside due to an accident, in being impaled or something like that. And so usually that's for 6 weeks, 6 to 8 weeks. Okay, and then it's reversed and you're back to normal and you've been an ostomate. Some people with cancer or some people with other bowel diseases, they opt to get reversed because sometimes their colon just needs a rest and then they can get reversed and be in remission. So it all depends on how severe your disease is or if it's what type of emergency. Okay, so accidents and injury can cause you to get an ostomy. Gunshot wounds, stab wounds. Some children are born with birth defects. That's another reason for an ostomy. I know I'm missing something. There are so many reasons why. An illness can cause you to get an ostomy. Gastroparesis, where your stomach stops working. Cancer, of course. There are other diseases. Anytime there's inflammation of the intestines, blockages, bowel blockages. Anybody can get a bowel blockage. That can cause you to need an ostomy, be it temporary or permanent. Sometimes people's colons rupture, or childbirth can cause you to get an ostomy, specifically cesarean sections. If the doctor accidentally nicks your colon or nicks your intestines, then you've got to get that ostomy in order for it to heal, and then it will be reversed. So that's just a few of the reasons. I know I'm missing some of them. And if you have questions or someone who may have gotten one for a different reason, just reply in the comments. Okay, but anyway, so basically those are, specifically your main reasons for needing an ostomy. So anybody at any time can get one. It's very hard on people who get one by surprise. A friend of mine, a real good friend who I never knew had an ostomy until I told him I was about to get my surgery. He was like, "Oh, I've had one for years." Guess why he got his? Eating spicy foods. Okay? He said he used to love spicy foods. He's Hispanic. And he said he loved the hottest peppers, the hottest anything. He said one night he went to a party and he ate a lot of spicy food at the party. He said the next morning he woke up in so much pain. He said that his wife called EMS. He said he passed out when he got to the hospital. And when he woke up again the next day, he had a permanent ostomy, permanent, because the spicy foods had eaten through his stomach and his intestines. That's how he wound up with one. Okay, but anyway, so the ostomy, this is a bag. This is what I wear on my, and we ostomates name our stomas. It's called a stoma. I call it a belly butt, okay? Not a belly button, but a belly butt. I have what they call an ileostomy. It is on the right side of my belly. A colostomy is usually placed on the left side. A colostomy is different than an ileostomy. A colostomy allows you to remain solid and everything. So the output is usually once a day. So a lot of people with colostomies irrigate instead of wearing a bag. Or they might stick the bag on, but they irrigate and there's nothing in the bag. So they can keep the bag on for however long they want to. Ileostomy, on the other hand, is when they remove your colon and the lower part of your intestines and everything. And in my case, they removed my rectum and my anus. And so my surgery was called a colectomy with a proctocolectomy. And so they removed my anus and my rectum, and I have what they call a Barbie butt. And what a Barbie butt is, and I know this is TMI, but it's for the greater good, okay? I have no problems discussing it. What that is, think of a Barbie doll. If you look at their butt, there's no hole there. So that was sewn shut. It's totally healed and it's closed. So that's no longer operable for me. But anyway, so this is what a bag looks like that I wear. These bags can be worn anywhere. The doctor or the nurse tells you to change it you can change it every 3 days to I usually wear mine a week. I change on Sundays, every Sunday. But I can go longer. If you have a good seal on the bag and everything, no problem whatsoever. But I change it once it starts looking murky because I like for my bags to look new, okay? And so what I do is we Ostomates, oh, we're fancy. A lot of people design their bags. They put glitter on them. A friend of mine made me some ostomy covers. I had got some for free from an ostomy group, and my friend, I gave her one of them, and she duplicated it, and she made some covers for me. So what you do is you stick the bottom of the bag through it, and you cover your ostomy bag with it. So if you want to wear it outside of your shirt, you can do that without the ostomy bag itself showing. And so other ostomates will see that, or they'll know that you have an ostomy, and they may approach you or whatever. I never wear mine out. Well, I do wear it outside of my pants, but I have it covered with my shirt. I'm not comfortable with wearing my ostomy bag out. And that's just my personal choice. A lot of people do, they don't care. But people don't want to see that. Although you cannot see through the bag, you cannot see output or anything like that. My bags are opaque. So ostomies have changed throughout the years. Okay. Another reason I want to say real quick while I'm thinking about it, that I promote awareness is because there are a lot of stigmas associated with ostomies. And like my friend who is deceased, that could have been a reason why she chose not to go that route, to have the surgery. There are so many stigmas that many people would rather die. In fact, on today, I was online at one of the ostomy groups that I frequent. We are trying to convince a lady she does not want to have the surgery. She's scheduled for next month. And the doctor said that if she does not have the surgery, she will die. And she said, I would rather die than to have to wear an ostomy bag because they smell and blah, 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 blah. And so we're trying to convince her this is the solution. This one little thing will probably save her life because we think we got through to her. M9 deodorizer. In fact, people without ostomies use this. You can put a few drops of this in your toilet bowl, and it's not like potpourri, potpourri mask and all that. But this is a neutralizer. This has no smell. Now, it is blue. It's colored blue, but it doesn't stain anything. But anyway, it neutralizes odors, period. You're not going to smell anything. Once you change your bag or empty your bag, you put 2 drops of this in there and you will not smell anything. Same with, I give this away to people who, with bathrooms and stuff and whatnot, like my sister. In fact, I gave 2 bottles to Robert because he has an RV that he bought last year. And I was like, you know what, your bathroom is in close proximity. So here, take a couple of bottles of these. And he said they have been great. So if somebody goes in, they don't have to worry about, anything. This neutralizes odors, 2 drops of it. In fact, nurses in the hospital, they take it because they'll spray it. They put it in a water bottle and they add water and put 2 drops in the water. And those who smoke, they go out and they spray themselves down with it and they have no cigarette smoke odor when they come back into the hospital. And so anyway, this is the solution to that lady who we just convinced to live, okay? So that reminded me on today, just today, World Ostomy, or not World Ostomy, but National Ostomy Awareness Day. That reminded me that this is why I advocate. Okay, so the M9. So any stigma you've heard that they smell, or if, we have a lot of people who say, oh, my ostomy smells so bad. They have no idea. No one has even told them about this stuff. And insurance pays for it 100%. And it's cheap. If you buy it out of pocket, you can get it right on Amazon. Now, you have to watch out for knockoffs because this is a knockoff of this same brand. It has to have the number 7717 to be legitimate. And if it has Chinese writing on the side, it's not the right stuff in case somebody wants to get some. You can get it right off Amazon for a few dollars. And I'm telling you, it works. And it eliminates all types of odors. It's not just for ostomies, but that's what it was made for by the company, Hollister. Okay, my journey has been great. I don't have any problems. I don't get any leaks. I mean, that can happen. You can have blowouts. I've had one blowout because I ate something I wasn't supposed to be eating. which is nuts. I can't no longer eat corn. I can't eat nuts unless I blend it so fine that it's going to go through my stoma. Those are the two foods that I'm restricted from. Anything else I can eat. I've never had a blockage, knock on wood, because a lot of people do get blockages, but there are ways to clear the blockage. You would drink some soda. Soda might clear a blockage. The only time that you need to go to the hospital with the blockage is if you start getting severe pain with it, or if you begin to regurgitate. If that happens, then your blockage is severe enough to where they're going to have to give you an NG tube to clear that blockage. But other than that, I've never had one. If you don't want to have output, like when I go fishing or if I'm traveling, you eat a couple of marshmallows, and marshmallows will stop your output for pretty much the full day. And then you resume the next day. So that's the trick, so it's a lot of good things, and then, you have, the bag. The other thing is I wear barrier extenders. This goes around this part of the bag so that it gives me extra room, for my stomach. So if something does happen to come underneath, or if this comes undone, the barrier extender is there to stop any type of leak. So I just don't get leaks or anything. Like I said, I had the one blowout, and that was my fault. And I have had a leak on 2 occasions, and those were my fault. I take what they call naked showers, but one time I decided to shower with the bag on because the bags are waterproof. Water beads right off the bag. I took it with the shower on, and it was a hot shower, and I didn't know that it had lifted up and loosened the sides of my barrier strips and the bag, and I ended up with a leak that day. It wasn't bad. It was just enough for me to know I had to change the bag. So now I just take what we call naked showers. And just like with traveling, you eat a couple of marshmallows before your shower, you get no output. So you can still swim, you can bathe, you can shower, anything, and nothing comes out. Never. I never have a problem. In fact, I call my stoma, and we name our stomas. Mine is named Oklahoma. That's what I named my stoma, or my belly butt, as I call it. So you have that. These are adhesive removers because you don't want to just rip a bag off. So they come in little, things. You just put it around your bag, and then it pulls right off easily when it's time to change. This is an ostomy belt. And you wear this around your bag, and that keeps it snug to you. You can wear any type of clothing with the bag. You can wear jeans, you can wear a dress, anything. Your bag isn't going to show unless you show it. And if the bag happens to fill up or whatever, you just go and dump it. It might bulge if you let it get too full, but most people don't. This is stoma powder. What you do is you put this around the area of your stoma so that your skin will not get irritated. Some people have allergic reactions to this. Everybody's journey isn't as smooth as mine. Mine has been smooth from day one. No problems with skin or anything. And so I use this, and then I use this barrier sting, barrier free. It's a no sting barrier, skin barrier. So I put the powder on, and then I take the pad from this and the liquid, and I pat it around the powder, and it creates a barrier film around my stoma that keeps any irritation at bay. So I never get irritated. And basically, that is it. And so it takes me all of 5 minutes to change my bag, and that's it. So it's a lot easier than going to the bathroom the regular way, I can tell you that. So, and the other thing I do, I told you that I like to keep my bag looking new and clean. Well, after I dump my bag, of course, it has to come down and go across the bag actually is facing this way when it's on me because this part goes over the stoma. And the bags come pre-cut, so I don't have to cut it. But anyway, so this is the way it's facing. Well, I used to notice that the flap, I would have to wash it every time, and I didn't like that. Well, if you put a little baby oil, and I just bought this today because I just ran out, put a little baby oil across the flap. Your output comes right out, and it leaves no stain. And you still wipe it clean or, whatnot. And then you put more baby oil on it, so that the next time, and it keeps everything clean and tidy. So it's real easy, real simple. And so in case you ever know somebody who ever needs an ostomy or whatever, send them my way. I can explain everything to them. And hopefully, if you know someone with an ostomy, you know, I've explained a little bit to you. You can ask them questions, or you can let them know that you know a little something about the ostomy now. And people are more apt to talk because of the stigma and stuff. People just don't talk about it and whatnot. But if someone knows that you at least know a little something about it, oh, they'll go to town with you and they'll talk about it with you because they know that you're not judging them based on it, you know, because it's a big thing. You ought to hear some of the things that people say about ostomies. You would not believe it, you know, and then they say the most horrid things, you know. I mean, it's like it's the end of the world, and they talk about, oh, they stink and blah, 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 blah. Yes, you know, in some places, if people don't know about the M9, it smells horrible. And it's not, you know, what you're thinking. It smells like asphalt. I was in the hospital and they had me on the ostomy floor because I was admitted for something else, but they put me on the ostomy floor because the doctor and nurse and everything wanted to make sure everything was okay with that, because they always check it when I'm in the hospital or whatever. And of course, they always want to look at the proctocolectomy. That's a whole nother story. The freaks, okay? People, you tell them about it, and you have to tell it because when they ask about your medical history, you have to tell them. They always find an excuse to look at my proctocolectomy. And I think because they just want to see what it looks like. You know, I know it's no other reason, but because it's really no reason to look at it. Nothing's wrong with it if I'm not complaining about it, but I tell them have at it, whatever. Tell me what it looks like because I've never seen it, okay? But anyway, and I'm into 30 minutes. Let me stop. I'll go on and on and on. But the thing is, yeah, the stigma, that's the main thing. The stigma. Erase all that. No, they do not smell at all. And ostomies have come a long way. Bags used to be clear. They didn't stick. People they had to stay in their homes years ago. Now, it's nothing like that. People swim in them. People play sports. There's some models. I have a friend who has an ostomy, who I've met since becoming an ostomate. She's a professional model, famously known. There's a lot of entertainers with ostomy. There's a whole slew of them, a whole slew. And they belong to the groups and stuff too. And let's see, what's something else? Let's see, entertainers, models. There's a football player now who has an ostomy, and there's a baseball player with an ostomy. I forget their names. Let's see. I can't, you know what? Now I'm losing my train of thought, so I'm going to end it here. But if you have any questions, please, always, at any time, if you have any questions, feel free to ask. I don't mind talking about it at all. And I hope you don't think that I shared too much information. It really is for awareness. And believe me, I could have shared more, okay? But I choose not to. But the thing is, feel free if you have a question, or, you know, you may want to ask something. I don't care. Just ask, okay? Or if you know of someone with one, you don't have to tell me who they are or whatever, but you can say, oh, you know what? I knew somebody, you know, with an ostomy, or I had a friend with one, or, you know, whatever. And I'll be happy to, you know, talk about it or whatever. If you have any questions. Okay, so that's it. I just wanted to do this, and I'm sorry. I said this was going to be a short video, and it ended up being over 30 minutes, but this is an important topic, and I hope that you stuck around to watch the full thing. And so now you know a little bit about ostomy, and you won't hear too much about it unless I happen to mention it in passing, or if I'm in the hospital or something, you know, crazy happens. But not until World Ostomy Day, and then I'll be back with my yearly video. So happy happy National Ostomy Awareness Day. And thank you for watching. Bye-bye. And may God bless you all. And know that there will be no Que-stead-Que if not for my Oklahoma. Bye-bye.